All right, let's discuss about animal bite and first aid. So whether it's a dog bite, snake bite, bee sting, or scorpion sting, the first few minutes are very necessary, right? That is, correct first aid can prevent severe infection, disability, and even save a patient's life, right? Let's go through each one by one. First of all, let's talk about dog bite. So, dog bites carry a significant risk of rabies, especially if the vaccination status of the animal is unknown, right? So, the first step is to wash the wound with soap in running water for at least 15 minutes. This alone can greatly reduce the risk of rabies transmission. Then, after washing, apply povidone iodine. Then, the patient should receive anti-rabies vaccine. Also, for severe or category 3 bites, rabies immunoglobulin is also required, right? Then, do not forget to give tetanus prophylaxis because it's very necessary. Now, let's talk about snake bite. So snake bites can be poisonous or non-poisonous. So even suspected snake bite should be treated as an emergency, right? So first of all, we should focus on immobilization, keep the patient calm as movement spreads venom faster. First, we will immobilize the affected limb using a splint or pressure immobilization bandage, right? Then ensure not to cut, suck, or place ice on the wound. Then we will rush to the hospital and we'll give anti-snake venom, right? Prophylactic antibiotics in case of big wound is necessary because bacterial infection can occur uh, in this case, right? Now let's talk about monkey bite. So monkey bites also carry a high risk of rabies. So first of all, we will wash wound thoroughly and we'll apply anti-rabies vaccine, rabies immunoglobulin during severe bite, and we should also go for tetanus prophylaxis in this case, right? Now let's talk about cat bites. So cat bites often appear small but can cause deep tissue infection because of their sharp teeth. It's necessary. So we will first of all clean the wound thoroughly. Then many patients require prophylactic antibiotics, especially if the bite is deep or involves the hand, because as I said that their teeth are sharp, so it can cause big wounds. So antibiotics is necessary, right? Then we will go for tetanus prophylaxis and rabies prophylaxis depending upon the exposure of the wound, right? Now rat bite. So first of all, we will wash the wound thoroughly, apply tetanus prophylaxis, give antibiotics to reduce the rat bite fever risk, right? And to lower the rabies risk, we can give ARV, that is anti-rabies vaccine, right? Now let's talk about scorpion sting. So most scorpion stings cause severe local pain, but some species can produce serious systemic symptoms also, right? So first of all, we will apply ice packs to reduce the pain and swelling, to provide appropriate pain relief, and monitor the patients, right? Pain management is necessary. Then we will give anti-venom in severe cases, and urgent hospital care is required, right? Now let's talk about bee sting. So the first step is to remove the stinger, right? Without squeezing it further. Then we will apply ice pack to reduce swelling and give antihistamine if needed. That is, we can give injection AVL. If the patient develops difficulty breathing, swelling, or signs of anaphylaxis, then we can give intramuscular epinephrine immediately and seek emergency care, right? Now let's talk about a wild animal bite. So bites from wild animals such as foxes, bears, or other wild mammals should always be considered high risk for rabies. So we should treat the same way as we have treated rabies exposure, right? Now let's discuss the most important topic, that is ARV dosing. So I have made 3 scenarios for you guys. So we will see how to proceed in each scenario, right? First of all, if a patient comes to you with no bite, then we will give 3 doses of ARVs. That is on day 0, on day 7, and the third dose on day 21, right? Second scenario, if a patient is bitten by a dog or any pet, but he has not taken any vaccine yet, then we will give ARV on day 0, on day 3, day 7, day 14, then any day from day 21 to day 30, and lastly on day 90. But remember that if any symptoms of rabies virus is appeared in this case, you must go for immunoglobulin, right? Third scenario is if a patient is bitten and he has already taken vaccine, right? Then we will give only 2 doses of ARVs. That is on day 0. And the second is from day 3 to day 7, any day, right?